A very good day to one and all. My name is Asdi Ganesh Atreya. So I have done my BSc Psychology from Mumbai and my PG Psychology from SNDT University, that also from Mumbai. I have been working in the field of HR for the past, before joining in the education field, I have been working there for almost 5 years. And then I have joined education field here in Dr. MGR Educational and Research Institute. My area of interest is basically in um, industrial psychology field and also in the social psychology, followed by the human development. So right now, this time I am going to talk few points related to psychopharmacology. So, psychopharmacology is also one of the important parts and aspects which is expected by a clinical psychologist to be aware of. So, that's where I'm going to start with the concept. So, here psychopharmacology is a field which analyzes the impact of different drugs on the mental health of the clients. It considers like how different compounds can alter the people's behavior by changing the way the person thinks or feels. It also studies the effect of drugs that it has got on the mood of the individual, the way he experiences sensation, his thought process, her behavior, judgment, evaluation, etc. It's purely a scientific study. As the word says, psychopharmacology, it tells us that it is a field which tries to bridge the understanding of behavior and the brain and also the pharmacological aspects. Okay, and the range of topics which is included here is purely broad and long. Psychotropic drugs is basically a technical term which is used for psychiatric medicine that alter the chemical levels in the brain, impacting the behavior and the mood of the individuals. It was available with us for more than 6 decades and it was known as the neuroleptic drugs. And in recent times, people have started finding it important to be read under the psychological aspect also. It manages the symptoms of organic psychosis and mania. Every drug has a side effect. Similarly, psychiatric drugs, they also have side effects. These side effects are so important because it leads to the client's care plan and the way the client needs to be managed. These side effects sometimes may also mirror in the sense like may show off the symptoms of the mental conditions which will aid in the developing plan. So, for example, if based on one particular drug, I expect the individual to become extremely active after consuming that drug, after the utilization of drug over a period of time, I expect that particular person to become active. He may or she might start showing some of its significance the moment they are actually they are or they have actually started by consuming those drugs. That can be an example of mirror the symptoms of mental conditions which will aid in the developing plan. So when I found that this particular component in the drug is making my client to be very active, so when I prepare a plan, I will see to it that there is some physical activity put into the plan or some plan or some schedule is actually added into the plan where we can also see the active side of the client and how that active side can further aid in the process of the client for a better improvement. So that's how this concept tries to explain here. The medicines are effective when they are coupled with the intervention process that are alternative for people with mental illness. In non-pharmacological intervention, it can be used in a psychiatric setting but is not limited to only therapies or counseling or any form of, psychoeducation, etc. So, how we can make these psychopharmacological drugs more effective in a client's process of healing or rehabilitating is we may actually combine that with some amount of the therapeutic intervention that we are doing. When we combine efforts, then the results turns out to be extremely good. On the same logic, we will try to combine in psychopharmacology the psychopharmaceutical drugs along with the interventions. When they are combined together, we are just trying to aid the client to improve and start functioning in a holistic level. So these are just the small efforts which we are trying to put across here. Further, based on the intervention which we are putting across here, sometimes we may find the client showing acute psychiatric presentation. So, what is acute psychiatric presentation? It is common when we try that with a psychopharmacological intervention, and once these acute symptoms are reduced, the improvement is seen in the overall patient's presentation like thinking, mood, perceptions, cognitions, etc. So, for example, if we are having cold, okay, and we are subjected to consume antibiotics, along with antibiotics, if you would have noticed, the doctor also prescribes an antacid drug to be consumed along with that, because these antibiotics, they start producing some amount of acid in our acid means, or some amount of, like, acidic components or gas, I would say, they start producing in our body. As a result, what happens, we start having a sensation of bloatedness. We don't feel like eating a lot of food. So in order to avoid that, along with an antibiotic, the doctor always prescribes an antacid to be consumed, so that these sort of bloating symptoms, or not having the interest in consuming anything, can be reduced and can be tried to be regulated. So on that specific period of time where we have antibiotics and we feel a sense of bloating in our body, we feel a sense of gases being released in our body, and we don't feel like consuming any drug, or consume not drug consuming any food for that specific period of time. That is an example of acute presentation, like acute presentation by the patient. So on similar lines, why I'm stating this example is I'm connecting it here because on similar lines, when a client comes to us for any form of mental rehabilitation, we try to utilize some psychopharmacological drugs also in them. Every drug has got a side effect, as we saw in the previous two slides. So, in order, sometimes those side effects, in order to avoid that side effects to prolong for longer duration of time, we try to combine it with some other techniques, some other methodologies. So this particular psychiatric presentation on the consumption of that particular psychotropic drug, maybe the client may start having severe perspiration happening, or severe loose motions, or severe vomiting. Everything is a process of detoxifying the body of the person who has been subjected to any form of substance abuses. So that particular difficulty of vomiting, loose motions, or perspirations, all these things are acute as they are there for a stipulated period of time. So with the effect of drug itself, the client will start showing different symptoms. And as a result, what happens slowly, we can see that with what objective we are giving that drug, the client is responding to that, and he or she is showing an overall good improvement through their presentation skills. Here we would like to go through the importance of clinical psychopharmacology. The specialty of clinical psychopharmacology is that it tries to offer the public increased access to distinctive, competent services by providing diagnosis and treatment and utilizing psychopharmacological agents as appropriate for the patient and his or her presenting problems. It also tries to enhance the team-based services. The psychologists are trained to meet the special requirements which can be provided through integrated health service settings and with more prominently seen in older populations and also in specialty specific areas. So what they're trying to say here, or what we understand from here, is that by having the knowledge of clinical psychopharmacology, we are just going to, aid the process of the enhancement of the client. And basically, this turns out to be effective mostly to the aged population and also for some specialty specific health conditions. Here we find an interesting concept where they say that according to the American Society of Clinical Psychopharmacology, pharmacologists must understand both what the body does to a drug, which is called as the pharmacokinetics, as well as what a drug does to the body, which is called as the pharmacodynamics. This include an understanding of interaction between multiple drugs, the relations between the genetics and the medications which is happening together at the same period of time simultaneously. As a basic clinical science, human physiology tries to encompass, or rather, it encompasses the physical and the chemical functions of the normal human organism, which is unchanged, okay? And it is unaffected by any form of diseases, illicit substances, or xenobiotics. Xenobiotics are nothing but these are foreign substances which tries to, interfere with our body functioning or other such entities, etc. So what they're trying to say here is, as the slide pretty clearly puts across here, is clinical psychopharmacology exclusively sees to it that the psychopharmacologist must know the two important principles, which is the pharmacodynamics and the pharmacokinetics when it comes to psychopharmacology. So based on that, they can include the kind of drug to which the individual can respond, and the drug also at the same time should not harm the individual's body also. Okay, so basically from multiple aspects they are trying to analyze the drug interaction, the drug health interaction, and the interaction between the genetics and the medication processes. Well, as you can see here, so far we were discussing that with the psychopharmacological intervention, we are trying to aid the overall response of the client and his way of functioning in a better manner. We are trying to do that, but sometimes what happens, because of psychopharmacological intervention, opposite condition also can occur, where it so happens that with what objective we are providing the client with psychopharmacological drugs, where we expect the client to improve and help in the process of healing, sometimes these psychopharmacological drugs may not help the individual to perform well. It may suppress the overall performance of the client. It may suppress the metabolism which is happening in the client's body. It may also at times, stop from giving ahead a desired effect or desired results out of it, or sometimes the client may simply not respond to any form of psychopharmacological interventions. After that, we find that there is highly important that we have an FDA approval when it comes to administration of a drug, because FDA is one of the governing bodies where it also tests the drugs and sees to it whether the drug tries to give the required response. Everything is based on evidence-based approaches. Everything is based on, they in the FDA, they try to, use that drug on an individual, see the individual's response as per the expected standards, and if there is no response, the FDA may not approve the drug, and if there is response, the FDA may approve the drug. Only after the approval of the FDA department, we can proceed in prescribing or administering the drug to anybody or any individual in this world. So that's why FDA is important, and their approval is of highly important matter. If there is no approval and we start administering it to the clients, there may be a situation where the clinician as well as the client might get into any form of legal issues, and we would like to avoid that here. Therapeutic psychiatry is a psychiatry which refers to the clinical treatment of the individuals in any form of civilian settings, okay, which can be in a mental health centers, hospitals, or rehab centers, and so on, or in custodial settings such as in jails, prisons, juvenile jails, etc. And this is also known as correctional psychiatry in the United States, and it is also known as prison psychiatry in the United Kingdom. Since we are talking on the legal aspects here, like FDA, the governing body, and the legal aspects, that's the reason why the therapeutic concept is brought in here, and also some amount of new terms are also we are getting to learn through this slide. Even though in the previous slides we were looking into the principles, like major principles, or two major principles, pharmacokinetics and pharmacodynamics, where the body of the client is involved, how the body responds to the drug and how the drug interacts with the body, and based on this, how the interaction takes place. So we have been going through those principles briefly in the previous slide. Now we would be trying to go into the principle in a much more detailed manner when it specifically comes to the concept of pharmacokinetics. Okay, so pharmacokinetics, whenever we study that, it basically studies four major mechanisms which is a part of pharmacokinetics, and they are ADME. A stands for absorption, how the medicine or how the drug is absorbed by the body. D is the distribution, how the absorbed medicine is distributed to various parts of the body. As we know, the medicine is a combination of different elements. It's a compound substance with a combination of individual components and individual elements, okay, in the required ratio. So how these elements or how these components, they are distributed to different parts of the body. Then the metabolism, how these impact the chemical functioning of these medicines, and how these chemicals, when they are released from the components, they modify our they modify not our rather they modify the individual's way of response towards the towards that particular drug. And finally, excretion, how the body eliminates the unnecessary, unrequired element from the body. So these four mechanisms together provides us a data which shows us the difference between the positive effects and the negative effects of the components on the body and the response of the client to these components. So they are studied in this process. These ADME basically helps us to predict the safety, tolerability of a compound in humans. Moving to the concept of pharmacodynamics, there are two ways how a medicine can affect the body. As previously I discussed, pharmacodynamics is nothing but how the drug responds to the body. Okay, so a medicine can change the conditions within the body, or a medicine can interact with the specific part of the body on a cellular level or at a subcellular level. The objective of pharmacodynamic studies is to gather information on how the medicine affects the body. This can be at, at a biochemical level, at a physiological level, and also at the molecular level at the binding areas. So when we are actually consuming a drug, a component is released into our body with a different medical or chemical combination. So this chemical combination helps us in understanding how it binds to the body, okay, and how it makes the body response or respond to it. It also allows the scientists to assess the efficacy of the medicine and also see whether or not the medicine is having the desired impact on the target, and if so, how good or how strong that effect has on the individual's body. It gives a better understanding on the relationship between the concentration of the medicine in the body and the strengths of its effects. So both PK and PD, that is pharmacokinetics and pharmacodynamics, together influences the dosing, benefits, and the adverse effects of the component in the body. The majority of the medicines, either they try to inhibit normal physiological or biological process, or inhibit any form of pathological processes. There are seven main medicine which are taken in actions, such as like major points like stimulating, where how it stimulates, depressing it, how it stops the uh, uh, how it stops the action through direct receptor agonism and downstream effects, blocking, stabilizing, exchanging, and the direct beneficial chemical reaction happening in the body, and also the harmful chemical reaction which may damage a cell and affect the body's function. Based on the previous two slides, now we can come to a fair conclusion which is drawn for pharmacokinetics and pharmacodynamics. So pharmacodynamics, it places particular importance on the dose-response relationship. However, the goal in pharmacodynamics would be to observe the optimum concentration of a particular dosage in order to see to it a desired responses obtained from the client. But sometimes, in reality, not only the optimal dosage observation can help us, but there are other factors also which may either aid the individual's healing process or may suppress the individual's healing process. So that's where the pharmacodynamics tries to highlight on. When it comes to pharmacokinetic factors, here the pharmacokinetic factors focuses on the peak concentrations, and concentrations here meaning that since we all know a drug is being provided to the client, a drug is a combination of various components. It's a compound element, okay? So every element has got a stipulated concentration rate, which is important for that particular drug to react on the individual's body system. So what they say here is they would like to study in pharmacokinetics how different components of the medication or the drug is responding to the metabolic breakdown and the excretory clearance. Metabolic breakdown means the metabolism of the client. So for example, to understand, I'm having two individuals who are complaining of severe fever. The temperature is very high. For one particular individual, I just give half a dosage of paracetamol. With half paracetamol, the the first individual, he starts responding. As his metabolic rate is high, his body is contented with just a half component or half quantity of the paracetamol, and slowly the temperature decreases for the first individual. Okay, seeing the results on this individual, what I think is, I can give another half a tablet to the next individual who's equally suffering with high temperature. But when I give that half a tablet to the second individual, the fever of the individual doesn't come down. So that means what? The metabolism of that second individual is pretty slow, and it requires more dosage, more concentration of paracetamol. So that is why what I do is, I end up providing him one full tablet of, I end up providing him one full tablet of paracetamol to see how he responds, and with one full tablet of paracetamol, automatically his temperature decreases. So this is what pharmacokinetic factors tries to analyze here. Okay. Finally, the genetic factors, they also have got a key role to play in the metabolism or the drug action of the individual, and the immediate status of the client towards the drug response based on the dosages. Okay, so with this I complete the slide. uh, Thank you.